Hey everybody, this is the last video in Module 4 for Module 4.3. And in this one, we're going to go over some of the disorders of skin and aging. Again, you see the learning outcomes here. So use those to help facilitate your study. All right, one thing that we need to talk about here is vitamin D. So vitamin D synthesis helps to happen here. And hormonal vitamin D is also called calcitriol. And when exposed to ultraviolet light, epidermal cells in the stratum spinosum and stratum basale convert cholesterol-related steroid into cholecalciferol. And although cholecalciferol can be obtained from the diet, few foods contain it. And in fact, most foods that contain cholecalciferol have been fortified with it. So the liver converts cholecalciferol into an intermediate product used by the kidneys to synthesize the hormone calcitriol. And calcitriol is required for stimulating normal absorption of calcium and phosphorus into the small intestines. An inadequate supply of calcitriol leads to impaired bone growth and maintenance of such and can form something called rickets. You can see rickets here. In addition to that, we're going to get into several diseases and disorders related to injuries of the immune system. So we have skin cancers, which are the most common type of cancers. And the most common form of skin cancer is the basal cell carcinoma. Okay, this is a cancer that originates in keratinocytes of the stratum basale and is due to mutations caused by overexposure to UV light. Metastasis virtually never occurs in the basal cell carcinoma, and most people survive these cancers without any complications. In contrast to that, you have the melanoma, which is the least common form of skin cancer, but is also extremely dangerous. In this condition, cancerous melanocytes within the stratum basale grow rapidly and metastasize to the lymphatic system. And the outlook for long-term survival in many cases is determined by how early the condition is diagnosed. And that happens in a lot of cancers as well. If the cancer is detected early, while still localized, the affected area can be surgically removed, and then the 5-year survival rate is about 99% or so. If the condition is not detected until extensive metastasis has occurred, the 5-year survival rate drops to about 14%. The last one that we'll talk about is the squamous cell carcinoma, which originates in the stratum spinosum layer and, like basal cell carcinoma, rarely metastasizes. This is the one that we can use the ABC rule for here. So you see the ABC rule listed here, the A standing for asymmetrical, B is borders, C is color, diameter, and E is evolving. So each one of these asymmetrical, meaning that one side of it is not the same as the other. The borders are not confined. The color is weird, lumpy, and brown. The diameter is very large, and the evolving means that it continues to grow. A few others, you have eczema, which is an allergic reaction that manifests as a dry, itchy patch of the skin, kind of looks like a rash, and it may swell, flake, crack, bleed, and can be treated with corticosteroids and immunosuppressants. You have acne, which I'm sure we're all too familiar with. It occurs from an overproductive blockage of sebaceous glands. We'll start to get into burns. So first-degree burn affects only the epidermis. Second-degree burn goes deeper and affects both the epidermis and the dermis. And third-degree burns extend through the epidermis and the dermis and then damage the underlying tissue and nerve endings. Fourth-degree burns include damage to all of the above skin as well as muscle and bone. And full-thickness burns cannot be repaired by the body and require skin grafts. There are several functions that are affected by burns as well. So your fluid electrolyte balance is one of the most common reasons people die because of burns is because of fluid electrolyte loss. You dehydrate very, very quickly when you lose the skin here. You also lose the ability to thermoregulate and to protect against infection. As you get into burns, we start to associate burns with the depthness and with the completion of the burn. And we can determine that by something called the rule of nines, which is essentially a method of estimating percentage of area burns. It's also modified for children because they have obviously smaller body proportions. You can see that the rule of 9 corresponds to most of these are divisible by 9. In emergency treatment of burn, a lot of this requires loss, replacing the fluids and electrolytes that are lost. Remember, because you dehydrate very quickly. Making sure that you provide sufficient nutrients to the body, because there's going to be increased metabolic demands for thermoregulation and healing because you've lost those factors of the skin. You need to make sure that you prevent infection. So you have to clean and cover the burn and administer antibiotics, because sepsis is a very prominent thing that happens here. And then you have to assist with tissue repair. So there's some other conditions in the skin. We have scars, which are collagen-rich skin formed after the process of wound healing that differs from normal skin. You can also get the formation of what are called keloids that you can see here. And keloids are essentially raised scars. You have bed sores, which happen in areas that are exposed to prolonged pressure, and that results from a loss of blood flow and then subsequent necrosis of the tissue. You have stretch marks, which result from the skin that is stretched beyond its normal capacity. And then you have some things that are called calluses and corns, which form from areas of constant abrasion and form a hard, thick layer there. I included here some staging of bed sores, just in case anyone was wondering. One of the big precursors to nursing school is becoming a nursing assistant, and one of your jobs is to recognize this sort of thing and notify the nurse of them. There's some also age-related changes that alter the appearance and structures of the integument system. So a few things as we go through there are the melanocyte activity declines. And in light-skinned individuals, the skin becomes pale. And with less melanin in the skin, people become more sensitive to sun and more likely to experience a sunburn. You can have sebaceous gland secretions decrease, and the skin becomes dry and often scaly. In addition to that, the epidermis thins as germinative cell activity declines, and the connections between the epidermis and the dermis weaken. And that makes older people more prone to injury, skin tears, and skin infection. The metabolic activity of the skin decreases, and synthesis of calcitriol, or vitamin D, decreases, which helps to lead to muscle weakness and brittle bones. Also, the number of dendritic cells decreases to about half of the level seen in maturity. And this reduction in cells may decrease sensitivity to the immune response and further encourage the skin damage and infection. And the last thing we're going to talk about, you have the dermis that becomes thinner and has fewer elastic fibers, making the integument weaker and less resilient. And this results in stagging and wrinkling, and are most pronounced in the body regions with the most sun exposure. You can see several more here. I may not ask you all of them, and that includes American sweat glands that become less active, which help to impair perspiration. You have a reduction in dermal blood supply, which helps to cool the skin. That can stimulate some of the thermoreceptors and make you feel cold even when it's warm out. You have a decline of sex hormones and differences in secondary sex characteristics that help to distinguish that, or at least in this sense, as you get older, that distinction lessens, which typically happens where you get to about 90 to 100. Because of this, most people of different genders are going to look about the same, and your hair follicles stop functioning and produce thinner, finer hairs. But we won't talk about all that much.